choice is colorectal cancer. Did you know that colorectal cancer is the third most common cancer diagnosed in the U.S. yearly? It's both in men and female. According to the American Cancer Association, there's 97,000 roughly cases of colon cancer and 43,000 new cases of rectal cancer. I can't talk. I've recently just started looking into this a little bit more just because of our gastroenterologist. They have a wide variety of knowledge on this, and about 7 out of 10 times when people get screenings done, they find polyps that can be cancerous or cannot be cancerous, so it's good to get diagnosed early. So I'm just going to explain a little bit what colorectal cancer is. If you look here in the colon, that's a polyp over here. So colorectal cancer occurs when healthy cells of the lining of the colon change and they start growing out of control and forming into like a tumor or what we know as a polyp, and you need to get that diagnosed early because it can become cancerous. So I told you that colorectal cancer is the third most common cause of cancer diagnosed in the U.S. Well, it is also the third leading cause of cancer-related death in the U.S. So it's more common than you think, and you really should get tested for it. According to the American Cancer Society, about 1 in 22 men are diagnosed with this yearly, and 1 in 24 women are diagnosed with this yearly. So men have it more often than women. So like I mentioned before, finding these polyps before they become cancerous is very important. According to the Cleveland Clinic, there's no cause for these polyps that they really see, but they're occurring in about 30% of the population. Common symptoms are up here of the polyps, which is diarrhea for over a week, bleeding from the rectum, blood in the stool, sometimes abdominal pain, and mucus discharge. Sounds yummy, right? So why do we get screened? I'm going to go over a few different screenings that we can do in the hospital. The first one that people usually do is a colonoscopy. This allows physicians to examine the entire colon and the rectum. They're under light sedation, and it allows for intervention. So this is one of the main ones that allows for intervention. The other ones are pretty much just testing to get imaging on if there's a polyp or not. This test is recommended every 10 years, and most people do get this one, but they're very shy to get it because they think, oh, a scope's going up the rectum. They don't want to, but you're under light sedation. The doctor sees it every day, so highly recommended. The next one is a computed tomography or colonography. It's also called a CAT scan, as people know it better as. That's recommended every 5 years. So what this is a virtual colonoscopy. This is only a diagnostic test. You need a radiologist to come in and read it. So you can have your GI doctor, the belly doctor, look at it. They know what they're reading, but you have to have a radiologist in-house look at the actual pictures and determine what it is. You're not able to intervene in this because it is just a scan, not like the colonoscopy where they have a camera up there and they have tools to take out the polyp or stop the bleed or whatever it is. Next is a fecal occult blood test. This is where we take a sample of your stool and this tests to see if there's blood in it. If there is blood and it tests positive, this usually tells you that there is polyps or there's some kind of bleed in your stomach. So we really want to figure out what that is. We don't know if the bleed's coming from somewhere in your GI tract or if it's from a polyp itself. And one of the other tests that we typically do is called a double contrast barium enema. This is recommended every 5 years. This is for people that can't go under sedation and cannot receive a colonoscopy or just would not prefer getting a colonoscopy. So what this is an enema containing barium, and it's given through the rectum, and this is going to highlight any cancerous areas in the colon or the rectum. And this is done by x-ray. Once again, this test does not allow for intervention, just a colonoscopy is the intervention type, or going in for surgery itself. So I just want you to take a look here. This is the colonoscopy. A scope goes in through the rectum and goes through your colon and is able to look at the entire thing. In this scope that they send up, it is able to do intervention, so they can cut out the polyps or anything like that. And then I'm looking at this over here. This is just the colon itself. So you start with your cecum. You have the ascending, transverse, descending colon, sigmoid colon, and then it goes into your rectum. Up there in the right-hand corner, colon cancer seen in a colonoscopy. So when they're going in through the scope, they'll see the cancer that looks like that, and it's just like a big ball of unhealthy cells that formed. I just want you to imagine some of our patients come in, they're feeling really weak, they're having bleeding in their stool, or per their rectum, there's blood in their stool, and sometimes there's severe cases of abdominal pain. Wouldn't you want to get checked out? I know I would. So if you screen regularly with your doctor, you may never have to experience any of these symptoms, and you can prevent yourself from getting colorectal cancer. So I want you to take some action. Like I mentioned before, colorectal cancer is the third most diagnosed cancer in the U.S. and the third most cancer-causing related death. If you get regular screenings with your doctor or go to your GI doctor, this can decrease your own risk for developing cancer. So would you take the chance of screening when they're so easy? Usually risk factors are your family, your age. They usually recommend getting a colonoscopy after age 50 and later on in life. But if you have a family history of developing colorectal cancer, we highly recommend getting screened earlier. If you call your provider today, you could eventually save your life. And I'm going to leave you on this note to be the one to lower the number of people who develop cancer by getting over your fears and screening every couple of years.